Health Watch InDepth presented by UMass Memorial Healthcare. I'm Olivia Lemon. Tonight's topics are smoking cessation and lung cancer screenings. I'm joined now by Dr. Max Rosen, who is the chairman of the radiology department at UMass Memorial Medical Center. What is a lung cancer screening?
Well, lung cancer screening is a CAT scan done at low dose to look for early signs of lung cancer.
Now, what are you looking for in those screenings?
So in the screenings, you're looking for any area of abnormal growth within the lung tissue.
And who should have the screenings?
The current recommendations are for people who are over the age of 55 and who have smoked more than 30 pack years. And a pack year could be 1 pack a day for 30 years, would be 30 pack years, or 2 packs a day for 15 years. Or people who have quit smoking but have quit within the past 15 years.
Is there a reason for that? Are they more likely to have lung cancer?
Not necessarily more likely, but the data that supports the lung cancer screening concept came from studying a group of patients who were between 55 and 75 and who had smoked 30 pack years or who had quit within the past 15 years. So that is the study group that we know the most about. So that's the group that Medicare has recommended that Medicare will pay for the screenings for those patients. And most of the private insurers have also followed Medicare's recommendations.
How long does a typical screening take?
The screening takes about 5 minutes to actually be in the scanner. But in order for Medicare or the private insurers to pay for the screening, they also require that the patient go through a shared decision-making process with their referring provider to make sure that the patient understands the benefits and the risks of having the screening performed.
Do patients get feedbacks on the findings right away, or does it take some time?
Usually it can take a few days or maybe up to a week, but usually within a few days, the referring provider would get the report back from the results of the scan.
Is there any risk involved in this screening process?
Well, the scan it's a CAT scan, so it uses x-rays, and there's, anytime you use x-rays, there's a very, very, very tiny risk of the radiation, but that's why we've designed the scans to use the smallest amount of radiation possible to provide an adequate image. Another risk of having the scan is if you find something, to do a lot of other testing or other invasive testing to work that up. And for example, somebody could have a nodule or potential growth in the lung, could have a biopsy, and could have a complication from that biopsy. That's why there are very strict guidelines about which patients should go on to have more testing after the initial screening.
When you detect an anomaly, what is the next step for patients?
It really depends on what the anomaly looks like, which is a combination of whether it's solid or less solid, and also on its size, and also what the shape of it is. So for example, a 3 millimeter nodule, which doesn't appear very solid, might just be followed in a year with just another lung screening, but a 2 centimeter nodule, which has irregular edges and is solid, might warrant an immediate biopsy.
Do all hospitals and doctors' offices have the same technology?
No. So the technology is a CT scan, and usually doctors' offices don't have CT scanners. They're either in outpatient radiology facilities or in hospitals. And then within that, there's different technology. The newer technology has very low dose, mostly through a combination of improved hardware, but also improved software. So here at UMass, we've invested in the latest technology and have low-dose technology at all of the sites in the system which are performing the lung screening.
Are there screenings that are more accurate than others?
No. Any scanner that you would be any modern scanner that you would be doing the screening on should probably have about the same amount of accuracy. The major difference between scanners these days is the amount of radiation that you need to produce an image.
Do you recommend a healthy person have these screenings?
That's very controversial. And at this point, the recommendation is for people over 55 with the 30-pack year smoking history, or people with that smoking history who have quit within the past 15 years.
As a system, how can patients access these lung screening processes at UMass Memorial?
So patients should talk to their provider, usually their primary care provider, about having the screening study done. The primary care provider can assess whether the patient is appropriate for it, whether they meet the inclusion criteria to be screened, and then the provider can schedule the exam at any of our facilities at either the university campus or the Memorial campus here in Worcester, at Marlborough Hospital, Clinton Hospital, or Health Alliance Hospital. As part of the screening process, under the current recommendations, patients also need to be counseled on smoking cessation. Patients who are coming and having the lung screening, if they're still a current smoker, need to be counseled on smoking cessation, and UMass offers many smoking cessation options.
What are some warning signs to look for that should result in someone getting a screening?
Well, because it's a screening, you're really imaging and testing patients who don't have any symptoms. So by definition, there really aren't any symptoms if you're going to do a screening study. And one of the benefits of imaging the lung, looking for lung cancer before somebody has any symptoms, is that you can often find the lung cancer at an earlier stage when it's more treatable, as opposed to at a stage when somebody's having symptoms, say a cough, or say coughing up blood or having other abnormalities.
Can you walk us through a typical screening process, kind of what the patient can expect?
Sure. There's no specific preparation needed, so you don't have to fast before. There's no injection of any dye or any contrast. Really, all that's required is for the patient to be able to lie in the CT scanner for about 20 seconds and hold their breath. Okay. And the CT scanner, the opening of the scanner is designed such that patients really don't get claustrophobic, because your head's not actually in the scanner, it's outside the scanner. The interest in lung cancer screening evolved from the idea that CT scans are much more sensitive at finding abnormalities in the lung compared to a conventional chest X-ray. So the National Cancer Institute performed a very large study at multiple hospitals around the country, which looked at, or which compared patients who were smokers, who half of them had a chest X-ray, half of them had a CAT scan of the chest. And what they found was that the CAT scan found more lung cancers, and it found more lung cancers at an earlier stage compared to a chest X-ray. They then followed these patients for several years, and they found that patients who underwent the screening with the CAT scan had a 20% less chance of dying from lung cancer than patients who had the chest X-ray. And so that 20% decrease in mortality from lung cancer is what's prompted people to be promoting the lung cancer screening, and what's prompted Medicare and the private insurers to pay for it.
How new are these screenings?
The screenings have been available for a long time. It's really has evolved parallel to CT scan technology. It's just that the data has become available in the past few years, which has showed the survival benefit of being screened with the CAT scan. And then also, as I said, the radiation exposure required to obtain the images has progressively gotten smaller and smaller, so the scans have become safer and safer.
Are they more common now? Patients are coming in more often
yes,
for them?
Especially now that Medicare and other insurers are paying for the scanner. The barrier of having to pay for the scan out of pocket has been removed, so we're seeing more patients coming in for screening.
Dr. Max Rosen, thank you very much for joining us. We'll be right back with more after this. Welcome back. I'm joined now by Tina Grosowski, who is the project coordinator of the Central Massachusetts Tobacco-Free Community Partnership. Tina, thank you for joining us. Why do you think so many young people are smoking today despite evidence that shows it's bad for them?
Well, thank you so much for having me today. It's an interesting question. The reality is actually very few young people are smoking today. The rates have gone way down. What's troubling to us, though, is the rates of young people using electronic cigarettes, or they call them hookah pens or vape pens. because they have high nicotine content. So of course we want to discourage young people from smoking, and we can talk more about that, but we're really currently also really alarmed by the rates of electronic cigarette use by teens. It's gone up 10% in the past couple of years. The state rate that's been just recently surveyed, the state has recently surveyed teenagers in Massachusetts in high schools, and that state rate is about 23.7%, so it's almost a quarter of young high school students have used or tried electronic cigarettes and are using them regularly.
With all the anti-smoking ad campaigns, has smoking gone down?
Yes, definitely. The rates of both adult and youth smoking have gone down in the past 5 years. We used to have rates around anywhere, depending how far back you go, up to 40%. So now the state rate for smoking for adults in Massachusetts is about 16%, except in some communities like Worcester and the greater industrial cities in Massachusetts, the rates are a little higher, from anywhere from 20, 21, 22, 23%. So that's why we have to spend more effort in these cities to reduce the smoking rates.
Do you think Worcester increasing its age to 21 to buy tobacco has been helpful?
Well, it hasn't actually started yet. The Worcester Board of Health just voted on it. It will go into effect October 1st. But there are other regulations that the City Council put into effect earlier that has helped reduce rates. For instance, a ban on the sale of tobacco in pharmacies. So each town can vote individually through either their city council, or it's usually through a board of health, to put in a town ordinance or a town bylaw to restrict the sale of tobacco at pharmacies. So over 120 communities now have put that into place, and Worcester was one of the first communities to put that into place. So that helps reduce access to tobacco by young people because it restricts the amount of places where you can buy it. Other restrictions that we are looking to see put in place here in Worcester that have been adopted by other communities are restricting the sale of flavored tobacco products to an adult-only establishment. So that would, again, eliminate the electronic cigarettes that come in so many different flavors, but also small flavored cigars and smokeless tobacco that come in flavors like Tutti Frutti, cotton candy, bubble gum, that are attractive to youth, and make it easier for youth to start a nicotine addiction, because that's what we're really talking about. We're talking about a nicotine addiction. So these kinds of regulations help reduce access to youth. So we spend a lot of our time working on those policies in the towns in Massachusetts.
What are some programs available in this region to help anyone quit?
So we're lucky here in Worcester because we do have both the state helpline, quitline resources, and we do have face-to-face counseling at the UMass Medical Center. So the state quitline is available to all Massachusetts residents. It's an 800 number, 1-800-QUIT-NOW, and anybody can call that number, talk to a trained tobacco treatment specialist to help make a plan to help them quit smoking. Also, if you're a Massachusetts resident and you have Mass Health Insurance, you can get all the medications or prescriptions that you need to help quit smoking free with a prescription from your doctor. So here in Worcester, we also have face-to-face counseling at the medical center, and anyone can access those treatment resources. You don't have to be a UMass patient. You just need to call 508-334-5393 and speak to someone about making an outpatient counseling appointment. We know that nicotine is a really hard drug to quit, but there are ways to make it easier. We know that counseling and medication together make it much easier. And again, having someone face-to-face to talk to makes it much easier. So to follow up on your previous interview on people who get lung cancer screenings who are current smokers, they then are referred to the inpatient tobacco treatment specialist here at UMass Memorial, and they make counseling appointments with her to look at making a quit plan for themselves so that they can quit using nicotine.
What would you say is the biggest hurdle for most people to clear while trying to quit?
Well, the biggest hurdle is first understanding that it's an addiction. that it's not a bad habit. The tobacco industry makes people think that smoking is pleasurable and that it's a habit-forming behavior. But it's actually an addiction. The nicotine is the addictive substance. And as I said, you have to replace the nicotine with other products, and then you have to change your behavior. So you have to get some counseling. So the biggest barrier is understanding that you need to get some help. It's perfectly okay to ask for help so that you can quit nicotine addiction.
What is it typically like in these, face-to-face programs or in a class where they're trying to teach you to quit? What are those classes like?
Well, there's very few classes these days. There are few for outpatient or inpatient people at UMass, but most of it is face-to-face treatment. So the treatment specialist will sit down with someone and look at what their smoking behavior is like, how much they do smoke, when they first start smoking, and then look at what their motivations are to quit. So health obviously is the number one motivation for someone to quit smoking. Then you want to look at maybe family and friends. If someone has new children or grandchildren, that would be a reason to quit. And then financial reasons to quit. Nowadays, if you're a brand name smoker, it costs $10 for a pack of cigarettes in Massachusetts. So some people roll their own cigarettes, which is pretty popular in low-income areas in Massachusetts. So you want to look at the financial reasons and the benefits financially to quit smoking. So if you're a pack-a-day smoker, you would be saving over $3,500 a year if you quit smoking, and that's something that you could use for food, for rent, for clothing, and for doing something fun, like going out to eat or go on a vacation. So especially for low-income or minority populations who are low-income, socioeconomically challenged residents, we really want to see them get the help they need to quit so that they can use that money for their families.
What is the success rate of these face-to-face or classes?
Yeah, you're usually at least between 25 to 35% rate of quitting if you use both the medications and the counseling. Again, using people's motivations to quit and then making a treatment plan and how to follow the plan, and then how to become a non-smoker and maintain your status as a non-smoker. That's what a treatment cessation counselor would do.
Now, you touched on them before, but what is your opinion on the alternatives, the e-cigs or the vapors, your opinion on those?
Well, the e-cigarettes, vape pens, and hookah pens are not regulated by the Food and Drug Administration. So they're not regulated by the FDA. So as bad as cigarettes are for you, and we know all the 7,000 chemicals in them, they do have to be regulated every by the Food and Drug Administration. So they test them regularly. They know what the 7,000 chemicals are. They know how they're burned. But the FDA does not regulate at this moment. They're proposing to regulate them, but they don't regulate electronic cigarettes. So we don't really know what's in them. They can say the amounts of nicotine that are in them, but no one is regulating it, so they can say anything they want. So you could order the parts to make electronic cigarettes and the ingredients online, go out on Main Street in Worcester and open a store and sell them if you wanted to. So there's no regulation on them. And that's why we're so concerned, especially for youth, beginning a nicotine addiction with them.
Why do you think they have become so much more popular recently?
Because young people do not understand the health risks for them. They think that they're healthier. People in general think that they're healthier for them. They don't understand the high level of nicotine that is in them. They are safer and less harmful than regular combustible burning cigarettes because there's nothing burning in them. They're a cartridge of nicotine and some aerosol, polypropylene glycol, and a battery that you turn on, and it heats up the nicotine of aerosol, and then you inhale it. So compared to combustible cigarettes, you're not getting the tar, which is the very carcinogenic element of burning in tobacco. But we don't know the long-term effects of them because we know the long-term effects of cigarette smoking, and that's why we have the lung cancer screenings, because we know without a doubt that the long-term effects of tobacco use. But since the electronic cigarettes have only been around 5 to 10 years, we don't know the long-term effects. There's some research that's being done. We know that the oil that the nicotine sits in can collect in the bottom of the lung. It can cause pneumonias. It can cause what they call popcorn lung, so it's deformities in the lung. But again, there's nothing definitive about them. So we don't recommend them to help people quit smoking, and we certainly don't recommend them for young people to start using them for nicotine addiction.
Now, when trying to help people quit smoking, do you approach youth differently than you approach adults?
Yes, that's a good question. Youth, adolescents, their brains are still developing. They don't finish developing until they're age 23, 24, 25. So adolescents, the last part of the brain to develop is called the prefrontal cortex, and that's the part of the brain that's responsible for good decision making and planning and organization. So we know youth don't listen to adults in the same way that adults listen to other adults. So you have to find different ways to motivate them, and they're much more socially oriented. So you want to do more behavioral interventions with youth than you would with an adult that you can do more cognitive treatment options with.
Now, what are some of the programs that you guys offer?
So as I mentioned before, there's the individual tobacco treatment specialist at UMass Memorial, both inpatient and outpatient. So if you come into UMass Memorial for surgery or to be in the hospital for some other reason, every inpatient is screened for tobacco use. And if someone is a smoker, they will be seen by the tobacco treatment specialist because we want to make their stay more comfortable while they're in the hospital. They cannot use tobacco products in the hospital or electronic cigarettes. So they're going to go into nicotine withdrawal, and so we want to give them the resources they need to make themselves more comfortable. And then, of course, when they come to be an outpatient, we want to help them look at what their success has been in the hospital. They've been there for 2 or 3 days without, or longer, without using nicotine from combustible cigarettes or electronic cigarettes, and help them use that success to maybe make a long-term quit attempt. And that can be done on an outpatient basis with the tobacco treatment specialist that sees people outpatient.
Here is an example of a new anti-smoking campaign. How successful has it been here in Massachusetts?
Yes, that's one of the new campaigns that we just ran here in Massachusetts, both online with the Facebook ads, so targeting parents of middle school age children on Facebook, and we also ran them on buses and on transit here in Worcester and in Boston. And so since it's a new ad, we don't know the greater results yet. We know that we had a lot of clicks on the Facebook pages, so that always is a good sign, that people are looking at the advertising. But what we do know that, as you asked before, that long-term media campaigns have been very successful in helping to reduce the smoking rates across the whole U.S., and that's a big public health success. So we have media, we also have policy, as I mentioned before, at the local level, but also policy at the statewide level. So we do a lot of education to the legislators so that they understand the dangers of these new flavored tobacco products and can help make the local regulations that we have town by town instituted on a statewide level so that the flavored tobacco or the pharmacy bans or raising the age to 21 can be a statewide effort, not just town by town. So when we have success at the local level, then the legislators see that and they can make a judgment and determine whether they think it's appropriate to have it be on a statewide level. So advertising and media are a very important educational component of the anti-tobacco, anti-smoking campaigns.
For someone who has been trying repeatedly to quit smoking and is having a difficult time with it, what kind of advice do you give to them?
Well, we know that quitting smoking is really difficult, and it takes some people 7, 8, 9 times to quit. Repeated quit attempts are important because each time someone quits, they can learn from their experience. And again, if someone goes to a trained tobacco treatment specialist, whether it's in person or over the phone counseling, they can use that past experience to help them look at a new quit attempt with the trained tobacco treatment specialist so that they can help them see what was successful and then how to help them with the triggers, like, you know, coffee goes together with smoking, or drinking alcohol, or driving, or talking on the telephone, and then how to deal with the withdrawal from the nicotine. And that's where you need to make a plan and stick to the plan and get help with that. So we tell people, no matter how many times they've tried to quit before, the next quit attempt might be their successful quit attempt for good.
Tina, thank you very much for joining us. We'll be back with more right after this. For more Health Watch news, tune into Health Watch presented by UMass Memorial Healthcare Wednesdays at 10 p.m. and 11 p.m. during Worcester News Tonight. And for past Health Watch segments, log on to our website, chartertv3.com/health. Thank you for joining us on this edition of Health Watch in Depth presented by UMass Memorial Healthcare. I'm Olivia Lemon. Have a great night.